Barry and I had just been married 7 months exactly. That morning, I had planned on going to work at about 7 and had set my alarm. All of a sudden, I heard moaning coming from the bathroom, and I found him laying on the ground, and he was laying on his left side, and I really couldn't see his face too well, and the first thing I thought was, oh my God, did he have a heart attack? And then I got down close to him to see that he was alert and he was breathing, and I asked him if he could get up. Well, he was bleeding from the nose, and he was bleeding from the head a little bit, and he said, in a very slurred voice at that point, just said, no, helpless. And that's about all he could get out. And as soon as I saw that, I said, oh my God, he's having a stroke. I think I was in shock. I don't think I believed it. It was like it was happening to someone else and not to me. But I don't really think it hit me hard until I got to the Rehab Institute. That's when I really broke down and realized, okay, this is really serious. My whole life really is going to change here, and so is his, and we have to start over. At that point, it was very important for me to know, that he was going to the best place possible. So I knew of the Rehab Institute of Chicago, and I pretty much had it in my head that that's where he was going to go. RIC admitting, this is Donna.
For nearly 40 years, the Rehabilitation Institute of Chicago has had the distinction of being one of the world's leading institutions, serving persons working to overcome physical disabilities.
Okay, when can we expect them? Morning, Barry.
Morning, Pam.
How are you today?
Good, yourself?
Good. Did you have a good weekend?
Real nice.
Did you go out on pass yesterday?
Yeah.
Oh, that's good. Where'd you go?
He was scared. He was very scared. In fact, I think he was frightened that he wasn't going to be able to do what they were going to ask of him. And then immediately, someone came in, one of the caregivers, and started telling him what to expect, and a nurse also came in, what he would need to do to, as far as like, he needed clothes there and needed to, just all the little things. But when someone's telling you immediately, this is how we run things here, this is what you need to do, this is what you can expect, it made me feel better immediately, and I think it made him feel more at ease. After the first day or two, he really said, this is the place where I should be, this is good, and I can see that I'm going to progress, and he felt a lot better.
Good morning, Ken.
Morning, Dr. Ross.
How you doing today?
Pretty good.
Good. Did you sleep well last night?
Oh, yeah, pretty good.
Good. Well, today is the happy day.
Oh, yeah, getting ready to go home here in a few minutes.
You feel like
it was a couple of weeks after Kenny's injury before we ever even started looking for a rehab center, and because we were worried about saving his life. And then I got hold to the Spinal Injury Association, and they gave me several names. They couldn't recommend anyone, but they gave me several names, and this institution was one of them. And then we started feeding it into a computer and started getting back all the information we could get on the top rehabilitation centers in the country. And every time, this one would come up with the very best.
I understand you have someone that Dr. Stevens would like to transfer here for rehabilitation. Okay, what is the person's name?
Well, after she had this seizure at home, we called 911 and my son downstairs, and we took her to South Shore Hospital, and they said she had a tumor on her brain. They told me that they had to shrink this tumor, and my wife didn't want to have it done until I convinced her that the doctors knew better than we knew. So she finally agreed to it, which was successful, to the best of my knowledge, and best with the way that the doctors tell me. It's successful. And that they've done their job, so that now it's my job.
There are some major losses after a patient has suffered a disabling event. And probably the first that come to mind are the physical losses that a patient would experience. The inability, for example, to walk or to feed themselves, to dress themselves. Someone who was functioning independently, going to work, enjoying life, able to do everything that he wanted to do, now may all of a sudden be stricken with an inability to perform any of those tasks. It's important for anybody providing care, rehabilitative care to patients, to take into consideration the totality of the patient, their mental well-being, their psychosocial situation, their religious beliefs, and the impact and the welfare of the family and their concerns also.
And I'm going to be interviewing you this morning, and then I'm going to go back and I'm going to read through your chart, find out a little bit more information about you, and then I'm going to come back and interview you and your husband again so I can get to know you and what your likes and dislikes are and how your stay will be at the Rehab Institute. Okay? During your stay, along with me interviewing you today, I'm also going to be your nurse therapist. So we'll get to know each other real well, and that means that I'm going to do teaching with you, and so that you learn a little bit more about what's happened to you and get you ready to go home. So when you go home, you'll feel pretty secure, and you'll feel like you know what's going on. RAC believes that discharge planning starts on day one, and so we want to get to know the patient as holistically as we can, so we can get to know them within their home, what their home environment was like, what their job was, what their family situation was, so that we can prepare them for returning back to the home or community setting with a wheelchair, with some sort of assistive device if necessary. RAC has a philosophy of mutual goal setting, in that we would like the patient to let us know what they choose to accomplish during their stay at RAC. The RAC team spends a lot of time sitting down with the family and the patient, talking about what findings we have found and what we believe we can look forward to in the next weeks during the stay at RAC. I met a lot of the therapists right when Barry came in. I was very nervous, and I think Barry was just very anxious himself too, and his therapist just spent a lot of time and took it very slow and made me do everything so that I was actually doing it, not just watching. She had me in there doing it and moving him around and making sure that I felt confident about what I was doing and that Barry felt comfortable with it.
The disabling event influences so many aspects of a person's life that it really takes a whole team of people involved in the care of the person.
At RAC, I feel like we're very team-oriented. We work with a number of disciplines: speech therapy, physical therapy, vocational rehabilitation, as well as a neuropsychologist. We really try to look at the whole person and evaluate where they're going to be discharged if we can upon admission, and focus in on the areas that they need specifically in treatment.
Through our years of experience, we have come to appreciate and encourage the uniqueness of each individual. We design a program for each of our patients with this uniqueness in mind.
There's no cookbook recipe for anybody, any one person. As I work with the different people, I make my goals very specific to what their needs are.
And that's why I think it's so important where you're going and how you feel about your therapists and how you feel about where, you know, just the whole therapy in general. Because we've talked about this since he's come home, and it's been actually a big topic of ours. I said, you have to feel comfortable with where you're going. You have to feel positive about where you are and your therapists and what they're doing for you.
The therapy is great, but all of the professional people here are tremendously great. Everything from Beth Golden, his nurse therapist, to Kelly, they're just wonderful people who realize that he's here to learn all he can learn, and then whenever he leaves, he's on his own, and that's just what they're trying to prepare him for.
A person's usual end goal is to become as independent as possible, financially, socially, physically, in every way. And by obtaining employment through training or direct job placement, they can achieve their goal of becoming as independent as possible. It seems that in general, most rehab hospitals don't always have a vocational rehabilitation department. And I feel that since we do have one, that's quite ideal, because we can work closely with the individuals involved with each person's care. Vocational counseling continues once a person's been discharged from the hospital, because it's an ongoing, sometimes lifelong process. We might see people after 1 year of their injury, or 2 years, 10 years, whatever. We're always there, and even when we're done working with a person, we always leave the door open to come back if some difficulty arises or they want to think about changing their career or some such situation like that.
We are committed to providing a caring and compassionate atmosphere for each individual.
He's always been impatient, and one of the first ones we went to, he was trying to pick up his leg, and he's weak, and I could see him getting angry, and she told him, she said, now, you know, you have to be patient, you know, and you can't be angry. And it was just like what I would have told you. And so, you know, they're real good with him, I think.
Oh yes, very quietly spoken, reasonable with the patient, not rushing anything, taking her time and giving my wife time to say what she had to say and to do the movements that they wanted her to try to do. They didn't seem as though they did just so much. They didn't want to tire her out, in my estimation. And it seemed to be another day. We can't do it in one day.
They seem very well trained in that they really care about what they're doing and that they care about the family and the patients. I think that that's the biggest, I think that has to be the reason why any of them would get into this, is that they care about people, and that comes through.
Our staff of 24 full-time attending physicians specialize in rehabilitation, have faculty appointments, and are board certified. Over 85 consulting physicians are on call to provide expertise in a variety of specialty areas. And while each of our physicians and staff members have the highest credentials, we believe that their dedication, enthusiasm, and compassion make them our most valuable resource.
You have to really become very involved with your patients. You have to be very dedicated with your job. A dedicated person that is willing to give that extra mile to work with that patient.
A day or so after they got him off the blood thinners, he got up and he was in therapy, and he walked. He started walking, you know, all of a sudden it just kicked in. And when he was telling me about this when I came to visit him that evening, he was so emotional and so excited and happy, and it was a big thing. It was a big deal for him, and he really likes his physical therapist, Karen. I mean, he just, you know, she just really makes me try hard, and I really like that. And she was even surprised when that leg kicked out. I saw her eyes just light up, and he goes, it was so neat to see her excited too, and he was just very, very happy about that.
It is important for patients to realize that improvement will occur, and to participate in therapies. And to do so, they have to have some belief or some hope that what they do is going to influence their outcome. They have to believe, they have to have hope that by going to therapy every day, something that may be difficult at first is going to result in improved function, that they're going to be able to do things now that they couldn't do before as a result. When they see it in themselves, when they see it in patients around them, they are more likely to participate, and the impact on the patient, I think, is tremendous.
And from what I've been told, that's the whole key to it, is my confidence level. I mean, if I give up, you know, it won't happen. It definitely won't.
Ideally located within the Northwestern Medical Center, emergency medical care is immediately available. For non-emergency care, patients may be returned to their referring hospital and their physician. In addition, RIC's lakefront location offers its patients and families a variety of activities within walking distance.
This is probably the best place in Chicago. You can catch a movie within just several minutes. You can get some of the finest food in the city within just several minutes. And when Kenny was in, before he was in the shape that he's in now, he was in, you know, his tolerance was really low. But yet we could take him and get him something good to eat, get him out of the hospital, and relieve a few tensions.
The Alan J. Brown Center for Alternate Communication unites technology and function to meet the needs of each individual.
Technology plays a very large role in a disabled person's life. It can make the difference between an individual being unable to express their basic needs if they're communicatively impaired, or it can make the difference between their ability to function out in the community as opposed to being restricted to their home environment, not being able to express even their most basic needs to their caregivers. It can allow them to be independent, for example, in terms of operating a computer system, and this can open up the world to an individual.
Technology may be seen as the advancement in materials, mechanical systems, electrical systems, and for our purposes here at the Rehab Institute, we're employing those advances to meet the needs of our physically disabled clients. For some, it means very sophisticated electronic devices, computer systems. For others, it might be a very simple mechanical device, like a mouse stick or a head pointer. They're intended to increase their independence, ensure their safety and comfort, just make them lead more active lives, not be as encumbered by their disability as they may be without these devices.
After nearly 40 years of serving the needs of the disabled, the Rehabilitation Institute of Chicago utilizes its accumulated knowledge, resources, and experience to stay on the cutting edge of the field of rehabilitation medicine. Each year, nearly 5,000 physicians, nurses, and allied health professionals come to the Institute from around the world to be trained in the most current methods available. RIC is committed to an ongoing research program ensuring that our patients' health care benefits from the very latest technology. Rehabilitation is itself a process of learning that will have an impact throughout a lifetime, both for patients and their families. This education is just one more part of the comprehensive approach to patient care that has kept the Rehabilitation Institute of Chicago a world leader in rehabilitation medicine.
I was angry. I was mad at the world. I just wanted to pound walls and yell at everybody in sight and just yell at Barry for letting it happen and the whole thing. I mean, a lot of it isn't even logical. It's just how you're feeling. And, you know, like, all right, if I keep going down this road, you know, you're driving home and you just have had it, the whole day has been really awful. And you're like, well, if I just keep driving on this road, where will I end up, you know? And then I won't have to deal with this anymore. But, you know, all right, I do have to. Really, you have to keep fighting, right?
Yeah.
It's the hardest thing.
And you have to have a lot of support from your families and friends.
And our friends have been wonderful. Yeah. You know, this is hard, but I think he's gonna be fine. He's got to smile more, though. But he'll be fine.
I don't remember the doctor's name now, I tell you the truth, but he said this is the place where she's going to have her therapy, and we're going to do a good job with her. And it just takes time. It just takes time. You can't say a week, 2 weeks, or how long, but it takes time. And every day you will see some progress. She's getting better. And I hope that she gets home soon.
Better each day?
Yes.
Each day?
I'm more optimistic about his future.
I think that Kenny will do good in life. I think that what he learns here will continue to soak in down through the years, stay with him. And I think that Kenny will do good. And I think he'll make us proud. But he's real determined, he's strong. He's everything that I hoped he'd grow up to be.
I hope that you enjoyed the rehabilitation video provided by the Rehab Institute of Chicago. My name is Sandy Gerosa. I'm an occupational therapist employed in long-term care and subacute rehab. I've been asked to come here today to speak on the subject of rehabilitation, trying to tie in the role of the healthcare assistant into the rehabilitation process. First, Let's take an overview of the interdisciplinary rehabilitation team, its composition, and its goal. The interdisciplinary rehabilitation team is composed of doctors, nurses, social workers, healthcare assistants, dietary, pastoral services, and the therapeutic disciplines. By that I mean occupational, physical, and speech therapy. The goal of the interdisciplinary rehabilitation team is to return the patient to home. Home can be a CBRF, an assisted living situation, a private residence, an independent senior apartment, or even long-term care. How does the team accomplish this? By maximizing a patient's medical, emotional, psychological, cognitive, physical mobility, and ADL independence level to its highest possible function. The role of the healthcare assistant is paramount in the success of the entire interdisciplinary rehabilitation team. Let's explore how. First of all, the healthcare assistant spends more time with the patient than any other discipline. Feedback from the healthcare assistant is respected and appreciated by all of the disciplines. For example, by giving feedback of the smallest changes in a patient's medical condition to nursing, by taking daily input and outputs, by taking weights, recording elimination patterns, the healthcare assistant plays an invaluable role for nursing in providing quality patient care. By acting as an extension of occupational therapy, the healthcare assistant helps to maximize the patient's ADL independence level to its highest possible performance. And this also includes continued education and adaptive equipment. Let me clarify here, by the term of ADLs, I'm referring to activities of daily living. This would include bathing, dressing, and toileting. To continue, by ambulating patients, assisting in proper positioning, encouraging wheelchair mobility, the healthcare assistant acts as an adjunct to physical therapy by following feeding and swallowing guidelines. This would include cueing for chin tucking, double swallowing, thickening liquids. The healthcare assistant also acts as an assist to speech therapy. Let me just say here that the role of the healthcare assistant, as well as all of the disciplines, is one of always extending to the patient confidentiality, respect, and dignity in order to ensure a safe and clean environment for the patient to thrive in. To sum up, the role of the healthcare assistant is of paramount importance to the success of the entire interdisciplinary rehabilitation team, because it is the healthcare assistant that is the key carryover person for the success of all of the therapeutic goals made. At this point, I would like to take a few moments to discuss healthcare assistant care plans. A care plan is a written communication guide completed by nursing, occupational, physical, and speech therapy that reflects a patient's current level of performance with ADLs, physical mobility, and also states pertinent medical information that may be needed. That is, a care plan states a patient's level of assistance that's required for bathing, dressing, toileting, what ambulation and or transfer devices may be required, what feeding guidelines may be needed, to name a few. It may also include such things as weight-bearing status, total hip precautions, continence issues, all the information that is pertinent for the healthcare assistant to know in order to care for the patient. Care plans are periodically upgraded and or modified by nursing, speech, physical, and occupational therapy, and it is the responsibility of the healthcare assistant to check care plans daily, noting changes in the care plan in order to provide safety for the patient and continue to maximize ADL independence. To sum up, a care plan is the healthcare assistant's guide for continuation of quality patient care. It is the healthcare assistant's tool for maximum participation in the interdisciplinary rehabilitation process. Through the course of our discussion, I made many references to adaptive equipment. I would now like to look at a few of the more frequently used pieces. First, we have a dressing stick. A dressing stick is used to help a patient doff, which means to take off, their shoes, socks, TED hose, pantyhose, and also to pull on their pants and underpants.
This is a sock aid. A sock aid, as you can see the stocking is already on it, would be used to help a patient that has decreased trunk flexion, for example, put on their stockings independently. This is a reacher. A reacher has multiple uses. It can be used to help someone put their underpants and pants on, to retrieve cans from a shelf in a kitchen. It can be used to clean up a floor spill if you grab at the end of it a dishcloth, for example, and patients have even told me they've used them to turn off their smoke alarms. This is a long-handled bath sponge, which uses to increase a patient's independence in their ability to wash their feet and their back. This is a long-handled shoehorn, which is very self-explanatory. Again, it would help patients that have decreased trunk flexion or total hip precautions, back pain, in order for them to put their shoes on more easily and independently. The next item is a weighted spoon that would be used by a patient that has tremors in order that they could self-feed themselves more independently. And the last item is an enlarged handled spoon, and that would be used by patients with decreased grip and pinch strength. I want to thank you for having me here today to talk about the role of the healthcare assistant in the rehabilitation process. And I'd like to wish all of you the utmost success in your new careers as a healthcare professional. Thank you.